Economy, our Congressman Tom Price, the chairman of the Republican Policy Committee, and Congressman Xavier Becerra, the vice chair of the House Democratic Caucus. Gentlemen, thanks for joining us this morning.
Thanks, John.
So you've got this repeal vote, Congressman Price, coming up on Wednesday. You've been there many times before. The outcome not likely to be different. Why do you feel the need to go back and do this again?
Well, this is a really important question because the status quo in health care is unacceptable. As a physician, I spent over 20 years taking care of patients, and I can tell you that the current system out there doesn't work. It doesn't work for patients. It doesn't work for doctors. Now, the President's law takes us in the wrong direction. It violates all of the principles we hold dear in health care, whether it's affordability or accessibility or choices or quality. The Supreme Court has said that it's constitutional. That doesn't make it good policy for the country. So what we believe we need to do is to provide that contrast, that positive, upbeat contrast for the American people to say, hey, those are the folks that are fighting for us in Washington for patient-centered health care, which means patients and families and doctors making medical decisions, not Washington. That contrast is important so that people, as they move into the fall, recognize that they have a choice here in Washington.
But because the vote won't go anywhere in the Senate, nothing will change. So, Congressman Becerra, is this more of a political show than anything?
Well, that's where we've come, John, is to the point where we're going to relitigate what we did 2 years ago. That's the point we've reached, a state of denial where now the three branches of our democracy have spoken and said, guess what? The Affordable Care Law is not just valid, it's sound. And so we should move forward. Try to help add to the, 6 million Americans who get Medicare who are now paying less for their prescription drugs because we're closing the donut hole. Talk to the 3 million Americans who are young adults who got to stay on their parents' health insurance as a result of the Affordable Care Law. All those folks are benefiting. We're getting rid of pre-existing conditions, which insurance companies used to use to discriminate against individuals applying for health insurance. All that's going, what we should be doing is building on that. But quite honestly, John, job one in Congress should be working with the private sector to build an economy that will create the jobs.
And we'll get to that in a second, but Congressman Price is champing at the bit here.
Well, look, what the Chief Justice of the United States said in his ruling was the court does not express any opinion on the wisdom of the Affordable Care Act. Under the Constitution, that judgment is reserved to the people. And the people understand that they don't want Washington running their health care, that there are wonderful ways to solve the challenges that we face, whether it's portability or pre-existing or getting folks covered, but you don't have to put Washington in charge to do that.
All right, so you want to repeal the law. I know that you've had your bill, H.R. 3000, out there for a while. It hasn't gone anywhere yet. But to Congressman Becerra's point, if you start to lose some of those things that people do like, and this idea of pre-existing condition, I think more than 80% of the population likes that idea. What do you replace it with? Because there is no concrete plan yet.
Well, the point about this, the Affordable Care Act, is that what pre-existing condition will be covered is what Washington says will be covered. What we believe is that the way that you solve that challenge without putting Washington in charge is to make it so that you have robust pooling mechanisms around the country so that individuals who are in the individual and small group market, those are the only ones that are challenged by pre-existing.
How do you do that, though, when the ability to buy health insurance across state lines is very limited at this point?
And that's why you need positive patient-centered reform. As I said, the status quo is unacceptable. You need to be able to purchase across state lines. You need association health plans to be able to pool together so that you get the purchasing power of millions. Let insurance work the way it's supposed to work, not Washington working for health care.
John, that's what the Affordable Care Bill does. It lets you pool together and have these exchanges so you can buy your insurance, exactly what Tom just talked about. You don't have to go back and relitigate what we did 2 years ago. That's the change that we need. But on top of that, we're busy voting on bills that are going nowhere while we have Americans who want to get back to work. We can fight, we can argue, we can have these political debates, but the court, the Supreme Court, the executive branch, and now the congressional branch have all said, this sound, let's move forward and build on it.
So are you saying let's move beyond this now? Would you tell your colleagues in Congress to run on this in the fall, to run on this, what the Supreme Court determined was a tax in the fall?
Well, we should build on the reforms that we saw in the Affordable Care Act because we want to make sure that every American has the quality health care that they want. But on the penalty, it's a penalty, not a tax. Ask Mitt Romney, who for 6 years said it was a penalty.
The Supreme Court clearly said it's a tax.
In
his opinion, the Chief Justice said, you know, Congress wants to call it a penalty. You can call it anything you want. You can call it a penalty. You can call it a horse. It's still a tax.
That's right. And the Supreme Court's role and the Justice's role is to tell us whether a law that's before it for debate is constitutional. And what he said it is. And how the justices decide to interpret that is up to them. But the bottom line is is it constitutional? The Supreme Court, some of these justices also said...
He said, though, it's constitutional.
Right,
if it's
and some of these justices also said that money is equal to speech. And so, therefore, if you're wealthy, you have more freedom of speech under the First Amendment than if you're not so wealthy. So the courts have interpreted many different ways. But the point here, if I could just make this one point. The point is this. We should be moving forward. Why are we going backwards talking about what was already done, litigated, debated, passed, and also affirmed by the Supreme Court? We should be talking about jobs. You were talking about jobs in your first segment. We should be talking about jobs. Well, Congress working together.
One quick response from Congressman Price to move on to jobs.
Again, just because it's constitutional doesn't make it the right policy for the land. And the American people, whether it's a penalty or a tax, what they know is that they're going to pay it. And that's the problem. People are having extreme, and that's the estimate prior to the ruling. 1%,
and only those Americans who decide to be irresponsible and be freeloaders. You don't pay the tax. John, you won't pay it. John, you won't pay it. I say it's not a tax. You don't pay this unless you are a freeloader. You don't pay, and you're being penalized if you decide to be a freeloader and ask someone else to cover your insurance.
Definition means that you don't buy the insurance that the government says you must buy. That's hardly irresponsible.
Gentlemen, we'll be covering this all week, so we do have a lot more to say on this debate. Let's move to jobs. The lackluster jobs report: 80,000, 69,000 the month before. You know, can President Obama go out there, Congressman Becerra, and say, "This is my record. Re-elect me in November"?
Anytime you can talk about 28 months of job growth, anytime you can talk about creating a job,
but we're not even treading water at this point.
84,000 Americans went back to work last month, John. I think that's pretty good.
We needed 125,000 jobs to stay just above.
4 years ago, what happened 4 years ago in June 2008 with jobs, we lost 280,000 jobs. What happened the first month that Barack Obama took office, or the last month, if you want to look at it this way, that George Bush was in office, we lost nearly 800,000 jobs. So when you gain 84,000, it's not enough, but it's sure better than losing 800,000 jobs or 230,000 jobs. We're making progress, 28 consecutive months of job growth, but you got to build on that. But if Republicans would take their foot off the brake of the economic recovery, we probably could move a lot faster.
Remember, John, what the president said. He said, pass my stimulus bill, and the unemployment rate at this point, under his proposal, would be 5.6%. Right now, we're at 8.2%, and it's really a whole lot higher than that, as you pointed out previously. The fact is that we're not putting in place the policies that will allow the job creators to create jobs. Keystone Pipeline, for example, the president refuses to allow that. This is going to create 20,000 to 200,000 jobs. Doesn't cost Washington a dime, and the president won't allow it. The red tape oppression that's going on across this country to keep small businesses and large businesses from expanding, making it so that they can't create jobs, the tax uncertainty and the tax increases, not just in Obama, in all of the president's policies, increase taxes on businesses large and small and make it more difficult for jobs to be created.
Point, then I just want to move on to
one quick statistic. I know my colleagues on the Republican side say that the health care law, which now has been affirmed by the Supreme Court, is a job loser. Since its passage, over 600,000 jobs created in the healthcare industry since the passage of the Affordable Care Law. And so what we see is that jobs are increasing. We just have to work together to make sure that they increase for everyone.
Let me throw one other thing out there quickly, because this is a big problem that's looming in front of us as Congress goes back to work next week, and that is the fiscal cliff that we're going to hit at the end of the year. There's been some suggestion, Congressman Price, and you've made it, that we sign something and kick the can down the road for another year. Is that the right way to approach this, or should the hard work get done to solve this problem?
No, this is where the cooperative nature of Washington needs to exist. We have a huge fiscal challenge, over $500 billion in increasing taxes at the end of the year. There are all sorts of taxes that are coming due. You've got marginal rates going up, capital gains going up, dividends going up, and what we need to do is to work and solve those challenges. What we will do in the House of Representatives is pass a piece of legislation before the end of July that says we ought to keep those rates exactly the same for at least a year, something that Governor Romney supports because he believes that will stimulate the economy and provide certainty out there in the job market.
What we hope is that we get
what's the cooperation from the other side.
As I said before, these are bills to nowhere. Tom knows they won't become law, and what we're doing is saying that we're willing to take the time of the people of this country, taxpayers' money, to run a House of Representatives with.
So what do you do? Do you let it expire? Is that the right thing to do?
No, you work together to come up with a real proposal that can pass both houses and get signed by the president. Not just put bills up there that you know are going nowhere. It's time for us to do something together, John, rather than work against each other.
I couldn't agree more. You know, the process that allows that to happen is for the House to act and then the Senate to act, and then you come together and solve that challenge.
Bills that have a chance to pass in both houses, not just doing something